It's night, and you're cozily lying in your bed, hoping to fall asleep. But suddenly, you experience an overwhelming need to urinate. And what if I told you that it's a sign of diabetes? Your body might be trying to send you a crucial message while you are going to sleep, one you definitely shouldn't ignore. In today's episode, let's learn about nocturia and other nighttime signs of diabetes you shouldn't ignore. Without any further delay, let's begin. Number 1. Nocturia. Nocturia is defined as the frequent need to urinate, particularly at nighttime. This can be a sign of insulin resistance. Let me break it down for you. When your blood sugar is too high, your kidneys try to get rid of the excess sugar. How do they do it? They filter out that extra sugar into your urine. To do that, your kidneys need a lot of water. So, when there's too much sugar in your urine, water follows. And that means you'll need to urinate more often. Nocturia can mess with your sleep, and this cannot just keep disturbing you throughout the night, but may also leave you tired and groggy during the day. So what should you do? First, pay attention to how often you're getting up at night to urinate. If it's happening frequently, talk to your doctor. Secondly, stick to your diabetes control plan. Take your medications as prescribed and watch your diet. Keeping your blood sugar levels within a healthy range can help reduce the frequency of nocturia. Also, try to avoid drinking too many liquids close to bedtime. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Number 2. Sleep apnea. Sleep apnea is a condition where you stop breathing for short periods while you're asleep. These pauses also come with other symptoms like loud snoring and choking or gasping during sleep, which can be quite disturbing. But how is it related to diabetes? Well, first you must understand that sleep apnea and obesity often go hand in hand. Having too much body weight is a significant risk factor for sleep apnea, insulin resistance, and type 2 diabetes. Probably it's because sleep apnea messes with your blood sugar, and your disturbed blood sugar levels can mess with your sleep. When you stop breathing, your body gets stressed, and that can make your blood sugar spike. When that happens too often, it can increase your risk of developing type 2 diabetes. So, if you find yourself waking up often during the night, snoring loudly, or feeling super tired during the day, don't brush it off. Talk to your doctor. They can help you figure out if it's sleep apnea and what steps to take next. Number 3. Restless leg syndrome. Restless leg syndrome, or RLS, might not be the first thing that comes to mind when you think about diabetes, but it's actually a nighttime sign of diabetes you shouldn't ignore. RLS is basically a neurological disorder that causes unpleasant or uncomfortable sensations in your legs and an irresistible urge to move them. Symptoms are often most intense at night when you are resting. See, diabetes or imbalanced blood sugar levels can mess with the function of your brain and nerves, making you feel anxious or confused. High blood sugar can also damage your nerve endings, causing symptoms of neuropathy, like feelings of tingling, numbness, and those creepy crawling sensations in your legs. So don't ignore this nighttime sign and talk to your doctor. They can help figure out if it's related to your diabetes or if there's something else going on. Number 4. Night sweats. Are you experiencing excessive sweating in the middle of the night? It could be a sign your body is trying to tell you something about your blood sugar. When your blood sugar levels go too high or too low, it can mess with your body's internal temperature, causing those nighttime sweats. Night sweats are especially common in people with uncontrolled diabetes. If you've got diabetes, your body might struggle to regulate sugar properly, and this can lead to those pesky sweats. So, if you're experiencing night sweats, then get your blood sugar checked. It's a simple test that can give you the answers to many health problems you may have. Otherwise, it can cause other sorts of health problems too, like heart issues, nerve damage, and vision trouble. Number 5. Nighttime hypoglycemia. Low blood glucose or hypoglycemia is when the level of glucose in your blood drops below what is healthy for you. For many people with diabetes, this means a blood glucose reading lower than 70 milligrams per deciliter. Your number might be different, so check with your doctor or healthcare team to find out what blood glucose level is low for you. Anyways, nighttime hypoglycemia can sneak up on you without warning. When your blood sugar drops too low during the night, You might wake up suddenly feeling shaky, sweaty, or even confused. That's because your brain needs glucose to work properly, and when it's too low, it doesn't function well. It's really important to not let that happen, because if your blood sugar levels are too low, you may not even wake up, which can be dangerous and even life-threatening. Now, I'm not here to scare you, but I want you to be aware. If you notice any signs of nighttime hypoglycemia, like waking up in a sweat or feeling shaky, it's a signal to talk to your doctor. They can help you determine the best plan to prevent it and keep your blood sugar in check. Number 6. Nighttime cramps. Experiencing nighttime cramps can be a sign of diabetes. These cramps, often in your legs, might wake you up from sleep, and they can be pretty painful. So why do they happen? First, you should know that cramps can happen due to many reasons, such as due to standing or walking for long periods during the day, dehydration, electrolyte imbalances, or deficiency of certain vitamins and minerals in your body. However, sometimes it's also linked to blood sugar levels. When your blood sugar gets too high or too low, it can mess with the function of your nerves and muscles, causing them to contract or relax abnormally and leading to those cramps. So if you're having frequent nighttime cramps, it's better to talk to a doctor. They can help you figure out what's causing them and whether diabetes might be a concern. Number 7. Nighttime frequent thirst. If you find yourself waking up at night with an intense thirst that just won't quit, it might be a sign of diabetes, especially if it happens often. When you have diabetes, your body may struggle to regulate sugar properly. At night, when you're not eating, your blood sugar should be steady, but in diabetes, it can spike. To dilute this blood sugar and remove it via urine, your body triggers the feelings of thirst to make you drink more water. And as I said before, you might also be using the bathroom more frequently at night. And that's why frequent urination and frequent thirst are the most common signs of diabetes. So, if you're experiencing this nighttime thirst on a regular basis, it's a clear signal to see a doctor. They can do some simple blood tests to check your sugar levels. If it turns out to be diabetes, don't worry. It's manageable with lifestyle changes, medication, or both. Number 8. Dry mouth. A dry mouth at night can be a warning sign for people with diabetes, and it's essential not to overlook it. Again, this is related to frequent thirst and other signs of high blood sugar. When blood sugar is high, your body tries to eliminate the excess sugar by increasing urine production, which can lead to dehydration. Dehydration, in turn, hampers the production of saliva, resulting in that uncomfortable dry mouth sensation during the night. But do remember that dry mouth can also be due to other things, especially when you are taking medicines for depression, heart disease, allergies, pain relief, or kidney disease. Therefore, if you're experiencing this sign in addition to other nighttime signs of diabetes that I've told you about, it's best to consult your healthcare provider. Thank you for watching and subscribing to the channel. See you in the next video.